everyone. Welcome back to Sanctified Wellness. This is Katie here. I'm here with Alexis, and we have a very special guest today. So we have Dr. Missy Gallow, and she and I connected probably within the past year. I think it was. Her business partner, Amanda, is my pelvic floor physical therapist. So we were chatting. We thought, how awesome would it be to have her on? Has a just wealth of information as far as pelvic floor physical therapy, holistic health as well, but also she has a very interesting birth story that I think will be very informative and also inspiring for a lot of our listeners. And we just chatted. We've chatted off and on over the past couple of months, and we have a lot of similar values, and really wanted to have her on the podcast and chat a little bit about how her faith also plays a role in both her practice, but also in how she raises her children, her birth story, just God's hand in all of that, and her career and her motherhood. And she's been inspirational for me as a client of her practice. So we'll just give it to Missy. Can you give us a little bit of an introduction on who you are, what you do, and get started there?
Yeah, thanks so much for having me. My name is Missy. I own Misama. We are a physical therapy practice that specializes in pelvic floor physical therapy. So like Katie said, my business partner and I, Amanda, own the practice, and then we have another therapist on board with us now whose name's Bridget, and we're just really excited about what we're doing in Columbus, Ohio. I have twins who are 7 years old, twin girls, and that's kind of back when I started this journey towards pursuing more of the pelvic floor world. I was an orthopedic therapist by trade, so I treated all your normal outpatient, orthopedic stuff, knees, hips, backs, shoulders, ankles, like all of that. And then I just realized, there's this missing piece that we just don't dive into enough in the outpatient world, and that's the pelvis and the pelvic floor muscles. So I just felt like I was doing my patients a disservice by not addressing that part of the body. And then having kind of my own pelvic floor issues and conditions and dysfunction, I really just dove into it. And then getting pregnant with twins kind of just escalated that even more to want me to learn more about it. And so I've been doing it for about 8 years now in this space. And yeah, I have a husband and a new little baby as well. She just turned 1. So I have 3 daughters, and yeah, pretty well.
That's awesome. Would you say that everyone needs pelvic floor therapy? Is everyone a candidate for it? Because I always wonder, would an OB be, hey, you should do this? Because when I was talking to my mom about this, she's like, yeah, my OB basically said, make sure you do your Kegels. And then that was it. I feel like it's kind of standard.
Yeah, it's really unfortunate. And I think our parents' generation really just took the brunt. They weren't really taught about this stuff. More awareness, more mainstream. The one good thing about social media is it has become a little bit more public. So women are seeking it out a little bit more, or advocating themselves, because we're still even in 2025, we're still just not at a place where all OBGYNs and all doctors are referring to this type of therapy. It's definitely a standard of care in other countries. We're always a little bit behind when it comes to the standard of care for women in the US, but I like to describe it as, I think this just really hits home with a lot of people and makes a lot of sense, is going to the dentist. Okay, you go to the dentist twice a year because, I don't know, someone told us that that's what we're supposed to do, right? We're supposed to go twice a year to just check on our teeth, even if there's nothing wrong with our teeth. And that's probably just from insurance companies that they were like, we'll pay for twice a year, right? Okay. But really, if you look at the research, you should go, I think the research shows that you should go to the dentist quarterly, but insurance companies will only pay for it twice a year. So we all go to the dentist. Well, we should go to the dentist every 6 months. But no one has created a standard of care for your pelvic floor. And to me, that's just kind of crazy, because it controls your bowel, bladder, sexual function. It's such an important group of muscles, but we haven't created a standard. So to answer your question, yes, I think everyone should have a pelvic floor therapist, just like they have a dentist.
Yeah.
Unfortunately, we're still in a place where we're in a more reactive healthcare model. So people don't seek it out until they need it, till they really feel like they have something going on. Kind of like going to the dentist, where you go and you get it checked on every so often. And then if they find something in an assessment, just like the dentist, they find a cavity, then they treat it, right? So hopefully that makes sense. I think that helps people realize that oh, wow, this is something that probably should just be part of everyone's healthcare team.
Yeah. Definitely.
Yeah, I'd say that that was probably, unfortunately, one thing that I did was that I just didn't even consider it until I was pregnant. And then I was like, pelvic floor PT, that's like, I should probably do that.
Yeah.
And what I found out actually working with Amanda is that an injury that I had I've had this for going on a decade, was actually a pelvic floor injury. And I thought it was just an adductor issue or whatever, stemming from my stance. And it's all connected. And unfortunately, I could have addressed, in hindsight, I'm thinking if I would have actually sought out this treatment earlier, it would have prevented a lot of pain just in my lifting. And that's something I had no idea about. And so, Missy, would you say that it's very common right now as it's becoming more mainstream, but like me, do you see a lot of women who come in who are pregnant or postpartum that's the first time they've seen a pelvic floor PT, and then they say, oh my goodness, like I've had these issues and it was my pelvic floor. And is that a common thing to have happen?
Like the most common thing, absolutely. Most people seek us out in their childbearing years. So they either learn about us during pregnancy, which is great because we love starting pregnancy. Some people don't even find out about this type of therapy until postpartum, and I wish I had this when I was pregnant. So I would say a good chunk of our caseload and population is prenatal and postpartum. But like you said, so many people have like these orthopedic conditions that are maybe like hip or glute or SI joint or adductor, like things that are sport related that maybe you've had, like you said, since high school, college, and they kind of are just like masked and disguised. And then we find the deeper layers that there is a pelvic floor component to it. So you're absolutely right. And that's why we love what we do, because we can really like figure out the orthopedic stuff on it. They often have a few other things that go along with it, like a few other musculoskeletal things that we can figure out. And they're like, oh yeah, well, I do have back pain too. And we're like, okay, great. We can tie this all together and get to the root cause of what's kind of contributing to all of the symptoms.
Nice. And do you recommend, like, with your program, strength training and things like that? Like, how does your program kind of work and how you tie that in? Is it like a lot of core work? Like, what does it look like?
Yeah. So once we do that first assessment clinic, which is an hour where we really just like look at the whole body mechanics, posture, we look at functional movement patterns like that. And then just depending what their goals are, that's how we'll tailor our plan of care. So it could include some intravaginal work where we actually assess the pelvic floor muscles internally, which gives us really like the gold standard picture of what's going on. It's hard to assess a muscle. We can't touch it, and we can feel it and touch it the best when we're inside the vaginal opening. So that gives us the most information on if a woman is using the pelvic floor the right way. It's very common that a woman might think they're doing, let's say, a Kegel, so a pelvic floor contraction, but they're actually not using their pelvic floor muscles at all. They might have really good awareness to their abs or their glutes or their adductors, like their inner thigh muscles, and they might actually be clenching all these other muscles, and they think they're doing a Kegel, but they're actually not doing a Kegel at all. And it's hard to know that until we're internal. We can feel it externally a little bit. But one of the big misconceptions is that every condition around the pelvic floor is a strength problem and that we just need more Kegels. So that's kind of like the overarching myth that we really have to break down in this country, is that we still get people that'll call in and be like, I need to get my pelvic floor strong for birth. And I'm like, where did you learn that? Or who told you?
Yeah.
So the main thing you need to do for birth is learn how to relax your pelvic floor, release. So it really just depends on the person. Some people need strengthening in terms of true pelvic floor strength. A lot of people need strengthening of other muscles, right? So we do a ton of core work, make sure people understand how to use their core muscles in like a pressure management type of way. So from the bottom up versus like a bear down type core contraction.
Okay.
Work a lot on like glutes, hip muscles, and adductors, things like that. But I would say we are different in that we are not just spending all of our time on the treatment table. We are manual therapists, so we do a ton of manual therapy that might be needed to help with someone's symptoms. And we also do dry needling, which is a technique here that we do. Most states can do it. I don't know actually if California. If
No, no.
Really?
Yeah, my acupuncturist, I have asked
Oh
her
my
and she's like,
gosh.
no, we can't. But I do like
Interesting.
the electrical pulse with my acupuncture. So she does that and cupping. But yeah, they can't dry needle here. I have no idea why. We have weird rules about everything.
But acupuncture hobby rule. I haven't dove to a few states that you still can't do it. But anyways, we do dry needling, and then a lot of our treatment is functional. So we're getting people in the gym. We're looking at, even if it's a woman that doesn't exercise or like spend much time in a gym, but they have children, like we know how busy a life is with kids. And like if someone's leaking while they pick up groceries or carry groceries, like we need to do those movements exactly. So there's a lot of stress that happen, but not always for the pelvic floor. It's sometimes for other muscle groups, or it's a lot of coordination. I say you can't use a muscle till you know what it is. So a lot of people don't really know where the pelvic floor is. It's not like see it. It's deep inside, so it's hard to conceptualize where it is. And if you don't really know where it is, it's hard to use it. We're not just going to have the leg on the table and do pelvic floor contractions because that's just not functional and it's not carry over to their day to day life as much.
Yeah, I think that that's something that's a misconception about physical therapy, at least coming from the athletic realm too. It's like, okay, you have an injury and then you see a physical therapist as opposed to that preventative work and also just your life and having kids and picking, like you said, picking up your toddler, picking up your baby. And that's something that Amanda and I, she specifically was adding in some different exercises where my spine isn't just perfectly straight because I've been a lifter. And so I think of things very, very much in that way where brace your core, everything's like, get down into a sumo lift and everything's just kind of in this perfect biomechanic way. My biomechanics are very much one way and life isn't like that. So I think that's something that my eyes have been open to as well. And what you all do is, okay, it's not just a deadlift. It's also you're picking up your children. You're not always in an optimal position. And so making sure you're strong enough to do that, because even as someone who has deadlifted, hundreds and hundreds of pounds, I've tweaked my back lifting up my son. It's like, there's an issue there.
Yeah.
Yeah. And breath work wise, do you guys implement a lot of that with your practice as well? And like, what does that look like? Because I know everyone's talking about breath work, but I don't know if everyone knows kind of what that means, I guess, for this type of therapy.
Yeah. Yeah. Breath work can be complicated because there's so many terms out there,
Yeah.
lateral breathing, heard of diaphragmatic breathing, heard of all these different breath. And I was like, what am I supposed to do? How am I supposed to breathe? But the reality is there's no like wrong way to breathe. Okay. Like every breath is fine. But if you have created a specific breath pattern and that is your kind of your go-to or just a like the pattern that you do most of the time, we want to make sure you have different breath strategies. So the first step is just like being aware of what your breath strategy is. And I would say it's very common that a lot of us have adopted like a chest breathing pattern. So that's just like very normal to you inhale, your shoulders rise, your chest rise, you use your like scalenes and use all your like accessory neck muscles, right, to do your breath. And so we teach a lot of women how to just like tap back into that diaphragm, to the rib. Like what is 360 breathing mean? What does diaphragmatic breathing mean? What is belly breathing? So they're all a little bit different. And like I said, none of them are really wrong, but I will watch someone do their movements and I will just assess their breath. And 9 times out of 10, I'll just say, what are you doing with your breath? And the answer is typically, I have no idea. Or I'm holding, right? Or like, oh, I'm holding my breath.
Yeah.
So there's zero awareness. Like people just are not aware of what they're doing at all when they're doing a movement. And so the breath is like one of the first things that we can quickly change and tap into. And if there are symptoms like change with just breath, that's amazing. And that's like an awesome thing that you can like in the clinic in one visit, you can get someone's symptoms better just by tweaking some stuff about their breath. Because like strength training takes, you can't get strong in one session. If we're truly needing to strengthen something, that takes 6 to 8 weeks. That's how long you do a strength block, when you're in the gym. You need 6 to 8 weeks to strengthen a muscle. So if we think someone needs true strength training, we're like, well, you're just going to have to wait and be patient and you might feel better in like 8 weeks. People are like, well, ridiculous. I don't wait that long. But a lot of this, like I said, is not just a strength problem. So it's breath, it's coordination, so many other things. And we can see like in clinic changes right away just by tweaking a couple little things. And breath is probably one of the most impactful things that we can change right away and get people to think about it in a different way. One technique I really like doing, I call it zone breathing. So I say you have like 3 zones that you can breathe into. You can breathe into your chest, you can breathe into your diaphragm and your rib cage, and then you can breathe into your belly. So zone 1, zone 2, and zone 3. And so I'll just have them do a basic exercise where they put their hands on the zones. And I'll be like, breathe into zone 2 first. Can I do that? And then I'll like create a pattern. I'll be like, okay, let's go 2, 3, 1 in an inhale, like all in one inhale. Let's go 2 first, then go into 3, then go into 1. Or we'll be like, let's go 3, 2, 1, or let's go 1, 2, 3. So we just like create awareness to different breath patterns, and just that can be just like a really nice reset and warm up before you do exercise to just like recenter yourself with how you're breathing. And like I said, no breath is really wrong, but we typically have preferences.
That's awesome. I really like that. And I like how you explained it too. It makes it like just makes more sense, and then you can control it and try to be aware. Yeah, body awareness is a big deal. So that's really cool.
Yeah, definitely. Can you talk a little bit, just because a lot of our listeners are sort of in that age of either having young kids or maybe going to have kids soon, kind of that common misconception of birth being like you need to like have a strong pelvic core, and actually because this is something that I had no idea about, was that breathing and the relaxation of your pelvic floor. And I think a lot of times, especially if you're an athlete and you come into pregnancy, you think like you need to muscle through it. But what actually is the truth when it comes to prepping for birth and the importance of being able to relax and that breathing and not just pushing through all the contractions and fighting it?
Right. A lot of us think that we can push our babies out with our ab muscles. I'm one of those people too, like, but the truth is your uterus does most of it. Your uterus is contracting. Your uterus is pushing. So while you can help by pushing, right? So when we teach our women how to push, we work a lot on pushing strategies. Both of it's like breath management and how we can breathe the baby out versus push a baby. Because if we our body, it can be really awesome. Like we don't have to work so hard. And so a lot of us think, again, the misconception that our pelvic floor needs to be really strong for birth or is to do a lot of the work and those are both really not true. Like I mentioned before, the pelvic floor really just needs to relax and get out of the way for the baby. So we teach a ton of ways to release pelvic floor tension. Again, you don't even know that your pelvic floor is tight, you're not going to know how to release it with it. So we do a lot of release work, whether that's manually with our fingers on a patient or teaching them how to tune into it in certain positions. So there are certain positions are better or more optimal for releasing or relaxing your pelvic floor. So something like child's pose, like a deep yoga squat, anything where your knees are wide is going to help open up the top of your pelvis, and also going to be just a really nice position to tap into what your pelvic floor is doing. So again, depending on how aware a woman is of the pelvic floor, might have that in seated, because sometimes like the feedback of something underneath them is really helpful, and they can feel their pelvic floor release into like a yoga block or something like that versus being on your back. I feel like on your back is sometimes the position that women can't connect to it almost the most. You need to be in a different position. So we flip them over onto hands and knees or get in child's pose or sit down or something like that, so that we can really tap into that pelvic floor release. And then when it comes to pushing, it's just that misconception that like you have to give it your all, like the pushing, where you're draining, you're popping blood vessels in your face, and so it's called purple pushing for a reason. In the face, because you're holding your breath so hard that everything is draining. And we have found that that's really not the most effective way to do it. Now, I always caveat that with saying there may be a time if you've been pushing for hours and if there's any like medical things going on and the heart rate dropping or blood pressure issues or things, doctor, we got to get this thing out right now. Like you certainly can give a one effort like push, but we're trying not to be there for the whole time. Like we don't want people pushing for 3 hours.
Yeah.
Ideally, you're pushing a really more strategic exhale kind of exhale. We teach women how to exhale their baby out while they kind of like bear down a little bit on the pelvic floor. Use some of your ab muscles. But again, if you have an epidural, it's hard to tap into all of that. So that's why this time is so helpful, because if you can practice this last month of pregnancy, you're going to be able to do it even with an epidural, because your body's going to kind of like have that coordination down because you've been practicing your breath. And even if you can't feel from your belly button down, you still know what you're doing with your breath and your pelvic floor onto your breath because of your.
Wow. I think that's like super helpful, because that was literally going to be my next question, like your thoughts on the epidural and not really being able to feel down there. Because all my friends, or most of my friends who've had kids, they had epidurals, and I just always was like, how are you aware like of what you're doing down there? And but that's cool. Like if you're practicing before, then you can still do that. But there is like, I'm loving this shift of people going really back to natural birth and really just like tapping into that and not being afraid of having babies. But Katie was saying that you have an amazing birth story, especially having twins. That's like really interesting. So can you share that with us?
Yeah, so my first birth isn't super eventful. I was pregnant with twins. And as soon as you get pregnant with twins, you kind of, all your dreams of a birth kind of go out the window. At least for it, I wasn't knowledgeable enough back then to advocate. And when you have a twin pregnancy, you're kind of like already high risk for so many things to consider, that I didn't think I was going to get to do it the way that I wanted to. I ended up getting put on modified bed rest at like 33 weeks because of high blood pressure. And thankfully, I never had preeclampsia, but I had to stop working at 33 weeks and kind of just rest and chill out. And then I got cholestasis, a common condition where your like liver stops ridding the bile, and it's not very good for the baby. So you have to, usually the protocol has been thus far that you deliver by 37 weeks, or stillborn rates are a lot higher after that. At least they used to be. I think things are starting to change in terms of cholestasis, but 7 years ago, that was the protocol. It's like deliver by 37 weeks. And again, I didn't know enough to advocate for a vaginal birth. One of my baby B was breech, but A was down. And my doctor was really just, I wouldn't say fear mongering necessarily, but just very much like, well, you could try for vaginal with baby A, but then you can't get baby B to flip. Then you could have a C-section with baby B, and then you'd be recovered for both. And like, that's not good. So it kind of scared me into just being like, I'm just going to do this. So it was a fine C-section. Again, being that it was elective, you just walk into the hospital and you like have it scheduled and you just go. I will say the recovery was still like very, for me, being like an athlete and thinking I'm super strong, and like, I've never had a major surgery before, but I was like, how bad can it be, right? Like, I know how to log roll out of bed. A big deal. It was a big deal. It was like very painful and hard to recover from. That was my first birth. And then I didn't actually think I was going to have any more children. We used fertility treatment to like get pregnant with the twins. And I just didn't know if I could get pregnant on my own. We wanted to try. Just like left it up to the Lord, and we're like, if it's meant to be, it'll be. And it was. And so I got pregnant, very shocked. We were not planning it. And my twins were 6 years old at the time. And so it was a big adjustment. Prepared for it. We had just started prepping to open Misama, the clinic business. So it was a bit stressful, but I thought, because God allowed me to get pregnant again, that he like must have had a plan for me and really wanted me to have this physiological birth that I always wanted.
Yeah.
Is determined that like, this is it. This is why I'm pregnant again, so that I have that I always dreamed of, like a vaginal birth. So obviously my goal was a VBAC, which if no one knows what that means, it's a vaginal birth after a C-section. And I then decided I wanted a home birth. So I researched a ton. I somehow got my husband on board, who, if you know my husband, he's a pharmacist, and he's very, like, pharmacists have very medical brains, and they're just very, like, they need the data, they need the research, they just, like, he needs all the information. So I thankfully was able to get him to watch The Business of Being Born, which is pretty old at this point. It was filmed back in the 80s, I think. But it's just a really good documentary on just kind of like the transition of prenatal care in the US. So he watched it with me, and it gives a lot of good statistics. And after he watched it, he was like on board to do the home birth.
That's awesome.
Hey, let's find a midwife that we feel comfortable with. I will say that's not what ended up happening, but that was the plan. It was a really good pregnancy to work with a midwife. So I ended up being pregnant till 41 plus 4. So I worked up until 40 weeks. My pregnancy was fine in terms of, medically great. My midwife care was great. And I was just waiting to go into labor. And so I finally called it quits at work right at my 40th, date. And I'll just say, like, the whole, like, the mental shift you have to have at that point, because especially if your friends or family know, like, what's going on, or you just have so many people asking you, like, well, how long is your midwife going to let you go? Or is this dangerous? Yeah. But, just so many things. You have to, like, set some strong boundaries. I would highly recommend just, like, not tell anyone. Your window. And your window is really 5 weeks. Like 37 to 42 weeks is the window for a birth. So I finally went into labor at 41 plus 4. And I labored, I won't go into all the details, but I ended up laboring at home for 2 days. It was about 45 hours. Went through 2 nights of labor, and everything, again, was medically looking fine. Like, my midwife was coming over, checking in on me. My doula was there through most of it. And the only thing that wasn't progressing was my cervix. So I wasn't dilating. And I never wanted to know how far dilated I was. So I never asked. I always just was like, is it any better? Like, am I like progressing? And she'd be like, no, not really. And so we tried to do some resets. I tried taking a Benadryl. I tried sleeping. I took probably 15 showers, I think. And I just couldn't get comfortable. Like, these contractions were intense. And no one know, and my husband knew how to help me with comfort measures. But by the 45th hour with 0 sleep, I called it myself. So I decided I wanted to go to the hospital. So there was no emergent transfer. It was like my own decision to transfer, because my hope was if I got an epidural to help manage the pain, then I would be able to get some rest and then progress and still get, like, my vaginal VBAC at the hospital. So I kind of just gave up my home birth dream in the moment, and it was really devastating in the moment. Like, I remember I was sobbing in my bedroom. I hadn't even packed a hospital bag. Kind of when you're preparing for home birth, you just kind of have to, like, decide if you're going to pack a hospital bag or not. And I chose not to, because, again, I just felt like that would help me zone in on, like, it's happening at home.
Yeah.
But I knew that was going to be the case if we did transfer, that it would be like, now we have a hospital. My wife was super nice. She was in my bedroom, literally, like, helping me pack my bag as I'm, like, at the bed and stuff, like, pack a little bit more. So we ended up going to the hospital at about that 45-hour mark, and got the epidural. And I was really hopeful that would help press me along. And so when we got there, she, of course, the doctors there wanted to know, like, what had been happening, and they wanted to know how dilated I was. And she asked if I was okay to finally hear how dilated I was. I was like, yes, that's fine. I'll hear now. You're one. And I was just like, I literally feel like there's a head. It feels like the baby's coming out, and you're telling me I'm 1 centimeter. Like, I cannot even imagine. I try not to psych myself out. So I'm like, I know you can go from 1 to 10 in, like, hours. So I got the epidural. It was truly amazing in terms of the relief that I got. and I was finally able to get a little bit of sleep that third night. And I chose to do the Foley bulb as well. So a Foley bulb is a mechanical dilation. So I was not ready. I did not want to do Pitocin yet. I wanted to try the Foley bulb first. And the Foley bulb can get you to 4 centimeters. That's like the most that it can do. So we did the Foley bulb. It is allowed to stay in up to 12 hours. And I had it in for almost the whole 12 hours, I think. It was like 5 p.m. and I think I had it until about 5 a.m. Finally got me to 4 centimeters. So I had the epidural, I had the Foley bulb. And so then they're like, you ready to start Pitocin? And I was like, fine. So again, I felt like I kept like having to just like succumb to the interventions that were being placed upon me. And it's like every intervention that I knew I didn't want, I ended up agreeing to do. So it was just so far from the birth I thought I was going to have. I decided to do the Pitocin, but again, I felt very in control of like picking and choosing when I got to add stuff. And I got to pick much Pitocin, so I chose 2 units every hour, where normally they would kind of progress you quicker than that. So we tried 2 units every hour, but again, once you get to like 10 units, they want to make sure your uterus is tolerating that well and the baby's tolerating it well, especially going for a VBAC, right? And you're at 42. So I was finally, at this point now, it's 3 days in, at the 42-day mark. And so they knew that, and they were like, okay, well, we probably should break your water. And I'm like, again, lots of questions. Like, it's all about asking questions, like, why? What's it going to help with? What are we trying to accomplish? All these things. So once you feel good about a decision, then you can move forward with it. So they wanted to place an intrauterine monitor, because it can monitor the baby even better than the ones they put externally on your belly. And when you're increasing Pitocin for a VBAC, to be safe, you should really have a monitor. And to do that, you have to break the water first. So I finally let them break my water. And again, I'm probably, 60-some hours into labor at this point.
Oh, wow.
I get to 5 centimeters, and then the baby starts not tolerating super well, approaching the 72-hour mark. And so that's when they started having the C-section kind of conversation of like, it probably would be best that we start considering that. Babies had a lot of big dips in heart rate. You've tried everything. We can keep pushing Pitocin, but we don't know how long she'll tolerate it. So thankfully, my doula was on her way, and it was pretty devastating, I'll say. And I picked a Christian doula, and she was amazing, and she came and she prayed. I finally decided that that's just what we needed to do. I ended up doing the C-section with her as well. It took a while to not be angry about that, because I felt like, God must have wanted this physiological birth for me. So, like, why did he not now want this for me? And then the other, like, lies that go through your head are just, like, I failed, my body failed, I'm not worthy of a physiological birth. Just like all the things that start going through your mind. So it definitely took many months to work through it. I don't think if I had strong faith, I would have. Just remind myself that, like, when you're at your breaking point or you're at your deepest sorrows, like, God is there too. Like, He's hurting with you. Not like He chose this for me. He wanted this for me as well. Unfortunately, physiology didn't allow it to happen. Doesn't mean my body failed me. You tell your people, will tell you how strong and resilient you were able to stay home for that long, and like how amazing and resilient and all these things. But it's like, those aren't the words you're speaking to yourself. You're speaking failure and like unworthy and all these things. It was a very interesting birth, and it was, it was something that I think when you plan for a home birth and you prepare mentally, you spend 9 times living, breathing. Like, I listened to probably home birth podcast.
Yeah.
Like, every VBAC, like, success story that I could. Like, you listen to everything to mentally prepare you for just, like, the goodness that can happen. And then when you couple that with, like, feeling physically you've prepared as best you can, doing pelvic floor physical therapy. I was doing chiropractic work. I was seeing my acupuncturist. I was seeing like a spiritual counselor through my church. I was doing like everything mentally, emotionally, spiritually that I felt like in my pregnancy. And so when it doesn't happen, it takes a while to figure out the why and like the reason, right? And like, why did this happen to me? What's the purpose here? And when you come out of it, it's how can I use this story to help other women? Because I think, like you mentioned at the beginning, like the physiological birth is becoming super mainstream, more talked about, like, and inspiring, telling us you can do this, God made you to do this. But we have to be careful that when things like this happen, that we don't shame ourselves.
Yeah.
Like, I've brainwashed myself to think my body is meant for this, and my body didn't do it. So then,
right,
so much shame, and God did not either. So I think we just have to be really careful that I think I'm one of the smaller statistics. We have gone so far in the wrong direction with our healthcare and our prenatal care and birth, and making it like a super intervention heavy event. And I totally agree that we need to work on that and change that. And there's way too many C-sections happening in this country. Our C-section rate is well over 30%, which is terrible. And so many interventions are being placed upon people that don't need to be, and there's tons of unnecessary happening. I truly believe that I'm one of the smaller statistics where if I didn't have the C-section available to me, my baby probably wouldn't.
Yeah.
So we just have to remind ourselves that some medical interventions were placed there for a reason, and I'm grateful that they're there. I don't love that I've had 2 C-sections, and I think it comes with lots of rehab and that you got to work through for years to come. But I'm grateful that my body, my uterus, the main thing people worry about with a VBAC is uterine rupture. And they think like, well, it's so dangerous because your uterus rupture. How could you be so irresponsible that you would choose to do a VBAC when your uterus could literally rupture? And you're like, well, if we actually look at the statistics, it's like 0.4% of people have a VBAC. It is like such a small percent. So with everything in birth, like you weigh your pros and cons and you weigh the risks and benefits, and only 4% is not enough for me. And so you do have to own your decisions. But clearly my uterus had no problem sustaining 72 hours of labor.
Yeah.
A uterus problem is a cervix problem.
Yeah.
yeah.
So,
yeah. Wow. Well, thank you so much for sharing that.
Wow.
So many times when you were sharing your story, it just came to my mind. I think a lot of times we all are in the mindset of, okay, yes, the medical system, it needs to be addressed and there's some problems. But at the same time, I think if we're not careful, we can kind of swing to the other side of the pendulum where we think we can almost speak something into existence, even if it's not God's plan for our life. And we think we have all of the control. Yes, there are certain things we can do. Like you said, all the prep you did, all of the work that you put into, pelvic floor PT and educating yourself on listening to birth stories and the spiritual side of things. But I think, I often have to remind myself, like, God's plan for our lives it's not always just success in everything that we want and the control that we play. We want to control everything, and that he works through these disappointments. And also too, I think a lot of times we wouldn't have the ability to have empathy or be able to help certain people that maybe are walking through something that's very similar. And so just in taking heart in that he has a plan through that. And it can be disappointing that we couldn't get what we wanted, but yet then that humbles us to remind ourselves we're not God and we're not in control. I think that's I really enjoyed hearing that story because I can reflect upon my own life and think about how many times I've been disappointed and where I'm doing, checking all the boxes, doing all the right things. And I think all 3 of us have a similar, we're driven, we want to achieve, and we have these kind of lists of things that we want to do, but yet, okay, are we thinking that it's all up to us? And that truly is not how God wants us to live our lives. And so that story, I'm sure, will resonate with so many women who are disappointed by something. And we live in a fallen sinful world. So I just love hearing that, and then also how God has really worked through that story. And I'm sure too, I mean, can you talk a little bit about, has it impacted your perspective in working with other women now? And have your eyes been open to kind of a different side of the maybe what some women are going through and benefited you in that way?
Now I've had this perspective of like, I've literally had every intervention. Yeah, I've had Pitocin, where before I had all this, I was like, Pitocin's the devil, so bad. But Pitocin is a tool, and we have to use our tools wisely. So if we're not using our tools wisely, that's when they become dangerous. And we're causing women to have to go to C-sections because we're putting their babies in distress when they need to be yet, right? But if we use our tools, if we educate women, you don't have to go like 2 units out. You can order different sizes. You can order an 8-ounce for 12-ounce for. Like, that's what Pitocin's like. You don't have to order the pint right away and get like a full dose. I think the most you can get of Pitocin's like 40 units, which is wild. And if you think like, okay, if you do the math and you're like, well, I'm getting a unit or 2 units in half an hour, like how quickly that can end up. But again, have the knowledge beforehand, you have no idea. You don't know what's normal. And if you just trust that the doctor is doing what is best for you. I'm able to have a perspective now where I don't shame a girl or that chooses to do Pitocin or that chooses to do induction. While I have maybe my own beliefs that like we prefer not to do an induction because it's just another layer. Some women need an induction. Maybe their body's never going to go by themselves, and they need it. Or maybe mentally, like maybe their anxiety is so bad that they need to know exactly the day that they're going to the hospital. Maybe they have a toddler at home and they have childcare issues, or they have no family support. You know, there's just so many stories that we can't judge a woman by the decisions they're making when it comes to their birth, but we can certainly educate them. And so if they're wondering if they should have an induction, I'm going to give them the best knowledge that I can on like why you might do the induction versus why maybe if the doctor is suggesting an induction, I just like to ask what's the reason, and if it's just for your age or guessing that your baby is a certain size, so they want to induce, or mostly the schedule that they want to do the induction for. Like those are reasons that don't sit super well with me because those aren't really good reasons. There's a whole slew of other reasons that maybe it is appropriate to do the induction. It's definitely just given me a great perspective to like not judge and support, just like inform, give the best information that I can so that women can just have positive birth experiences no matter what interventions they end up choosing. I had a patient recently that decided she wanted a C-section, and she had a vaginal birth the first time, and she pushed for 3 hours, I think 3 or 4 hours, and had a pretty significant tear, and that was traumatic for her. And so she was really worried about having, she's small, she's like 5'2". We know that when you're shorter in stature, like there are statistics that make you a little more prone to tearing in your perineum if you have a big baby. And she had a big baby the first time. So she already had that data, right? She had data that her first baby was big. And that she told. So now she gets to if she wants to have an elective C-section or go through a vaginal birth. If I had seen her before this last birth experience, I probably would have judged her a little bit and been like, why on earth would you use a C-section when you could have another vaginal birth? That's all I've ever wanted, right? Was a vaginal birth. But for her, that thought of like pushing again for 3 hours and having another care and having another big baby, and then having a toddler at home also, like, that was just too much for her. Really, that like the elective C-section was what she wanted. So my job then was to support her and to help her know what to expect for a C-section. This is what you're going to expect. These are the questions you need to ask. This is what you need to do the first day, the first week. I just helped her prepare so that her first 3 weeks after the C-section were like as best as they could be.
Yeah. No, I'm sure that's so helpful too because you've experienced it and you're like, listen, this is what you need to expect. Because I feel like I do follow a lot of like birth pages that are like natural birth, at home birth, and they do all look like so peaceful. Like some women are like, oh yeah, like I had my baby in 65 minutes. And I'm like, I didn't even know that was possible. But I do enjoy them because it is such a beautiful thing. But like with your story, I loved how you're like, I tried for as long as I could. And at this point, I was like, okay, it's, getting dangerous. I'm in so much pain. I'm exhausted. You also have to do what's best for you and for your baby. You're not just thinking about like, well, this is just my dream. Like, you were just like, okay, I really I want to have a healthy, happy baby. And if I have to do every single intervention, like even if it's against my will initially, then that's okay too. And I think that's such an important message because I think like obviously I don't have kids, but I think I have like more of like a dogmatic kind of like viewpoint because I'm like I've watched all these things and like all this stuff. I was like I know it's possible, but sometimes your body is just like nope, and the gift in the end is you still have your beautiful babies and like that's the most important part. And the birth story, I'm sure probably has blessed so many women who probably was like, oh my gosh, like I'm a failure. I just want to choose this or that. And I mean, it's even just a blessing just to hear it and be like, I tried, like this was my birth plan. This is what I wanted. And that was my dream. But in the end, the most important part is that you have your beautiful baby. And that's the ultimate, gift there at the end. So that was like really encouraging and just moving just to hear your story. Cause I've
Yeah.
never even thought like, oh yeah, like, I've always heard the transfer rates are really low, like from home births to the hospital. But, if you're laboring for days and days and days, you're just like, okay, this baby needs to come out and you're not progressing at all. Like, of course you're going to have to do that and make the best decision for you and your baby. So that was definitely like really encouraging.
Yeah, transfer rates are pretty low, especially emergent. Those are low, which is great. Like midwives should be trained well to know when it's become emergent and hopefully catch it before it becomes a non-emergent. So emergent transfers should be even lower, but finding a midwife that has a very low transfer rate is obviously important when you're going to look for one for a home birth. And then I will just say, like, even though I had the birth in a hospital and I had a C-section, because I was working with a midwife through my pregnancy, she was still my midwife. So I still got the postpartum care that a home birth person would get, which I just can't even imagine not having that after this birth. Like her being at my house 2 days later, 5 days later, 7 days later, 14 days later, she came probably 5 times weeks, whereas I would just be going to my first appointment at 6 weeks with
Yeah.
and it just the difference in the care afterwards it was part of the healing process too of getting to know, getting her postpartum, we work through even that, and I don't regret working with.
Yeah, definitely. And so if people want to find you in the Ohio area, what's your website, your Instagram? How can people work with you and get in touch with you for all the therapy things and all that good stuff?
Yeah, so we're Misama, and our website is misamawellness.com. We are fairly active on social media, so we're Misama _ Pelvic Wellness Pros, and we do mostly one-on-one physical therapy that we talked about, but we're starting to do some other postpartum fitness class that we're starting to run. I'm really passionate about helping postpartum women like get confident back in the gym. So it's kind of a 6-week cohort that runs quarterly throughout the year, and they come and they get to work out with me or one of our other therapists. It's just a service I really wanted to offer because nowhere in Columbus, I don't know, other cities probably not super common either, that you can get guided like small group personal training essentially with a physical therapist. It complements so nicely because a lot of these women in the postpartum fitness class are also patients doing one-on-one care, so it's just a really great complement. All just getting strong, and it's so awesome to see them get confident under a barbell or with dumbbells that they're like, I do not think I could have done it. And then help them like find a gym or find the atmosphere that they want to move on to. So we offer that, and then we just launched our labor and delivery prep course too. So it's called Misama Mama, and it is an online education course for labor and delivery prep. So a lot of what we talked about, like we want to just give more people access that can't come in person to see us. like access to the knowledge and education that we think they deserve as they walk into a birth. So that's up on our website and accessible to anyone in the world, which is super exciting.
That's so awesome. Yeah.
Well, yeah, thank you so much. It was such a great conversation about PT and pelvic floor physical therapy, but really your birth story was inspiring, and
Yep.
we really appreciate you sharing that. And I hope that someone, I mean, I'm sure someone listening can resonate with a part of that story.
Yeah.
And just can feel encouraged by that. So we really appreciate you coming on and taking the time to be with us. So thanks everyone for listening, and we will talk to you in the next episode.
Bye, guys.
Bye.